Okay, good morning, everyone. Thank you all so much for being here today. My name is Angie Cummings. I am a research faculty with the Division of Public Health Pediatrics at Baylor College of Medicine and Texas Children's Hospital. And I have the great pleasure of working with our colleagues at Mental Health America of Greater Houston on their integrated behavioral health initiative. And so today we're going to talk some about quality metrics and measurement tools. I'm going to share my screen, and I'm also just going to let y'all know that I moved over the weekend. And so this is my inaugural presentation from my new setup. So if you can't hear me or if something looks weird, please let me know. I've now shared my screen, so I can't see you anymore. So feel free to just, speak up. I'll try to keep an eye on the chat, but just speak up if something is going on. Let me start by asking, can you all see my screen? Can you see my slide?
Yes.
Okay, wonderful, wonderful. So let's go ahead and dive on in. So for today's presentation, we are going to identify changes across multiple levels in your clinic that would be necessary to integrate behavioral health. Hopefully by the end, you'll be able to list some potential measures to monitor integrated behavioral health progress. We're going to discuss some tools, templates, reports, basically, what will you need to make sure you're gathering the right data for your measures? And then finally, assess the contextual fit of measurement tools. So again, keeping the end in mind, if you want to be able to report on X, what data do you need to report to be able to get there? And so let's start with a little bit of housekeeping. I want to attempt to use the annotate tool, and sometimes that appears at the top. I am honestly not seeing it though on my screen. So Gina, can you see annotate at the top of your screen?
I do not. I don't.
Okay, well, that's okay. We will be able to work around that because even when I click more, I don't see it. So sometimes you can annotate and you can draw something on the slide and it's kind of fun, but it's no big deal. The other thing that I want to point out is for you, it may appear at the bottom of your screen, but on your Zoom controls, there is a little button called polls. I just pulled mine over onto the screen. But it says polls and has like 3 little lines, like a bar graph above it. And we're going to have one poll that we'll ask you about. And if it doesn't pop up on your screen, go to the bottom of your screen where your Zoom controls are, and you can click on polls. And then right next to that, to the left, is the chat function. So if you've got a question, again, feel free to ask at any time. I don't mind that at all, but you can also put it in the chat. And if you click on chat, you can say if you're sending that chat to everyone in the meeting, or if you're sending it to one particular person in the meeting. Okay, and so with that, we will continue. So I wanted to know where everyone was located, and we were going to use the annotate button, but that one doesn't seem to be happening. But what I heard in the introduction is we've got folks from Houston, we've got folks from San Antonio, I believe there was an Austin, someone in Harlingen. So it sounds like we've got some pretty good representation in various regions of Texas. So it'll be interesting to hear in the discussion how everyone is doing. So again, thanks for tuning in from across the state. Okay, so to get started, I would like to do this poll and just find out where you are in your integrated behavioral health journey. And this is a poll that hopefully will either pop up on your screen or like I said, you can, let me show you what it looks like. There we go. So you can click if you are, exploring and researching, you're gathering information, you're just getting started. you have a system, but you're still tweaking things, or you are a well-oiled machine.
We're getting some responses, Angie.
Yes, excellent. Okay, so it looks like most people here are in the have a system but are still tweaking things. And that's great. That's great. I think that will lead to some great discussion later, and really great for learning from one another. So we've got about just under 20% who are exploring and researching, kind of figuring out where do we start. This is a big beast. About a quarter of audience members are just getting started, and then about 60% have a system but are tweaking things, and nobody is claiming that they're a well-oiled machine just yet. But give it time, give it time. I have faith in you. All right, I'm going to end that poll, and I can share those real quick so you can see them. Okay, great. So now I would like for you to use that chat function. And when you're thinking about integrated behavioral health, what does success look like to you? And how will you know when you've achieved it? And you don't have to have a super formal response, but what comes to mind when you think about what does success look like and how will you know when you've achieved it? And if you could type that in the chat and send that to everyone, please, that would be really great for us to be able to see everyone's responses. All providers come to the behavioral health professional to see a patient in a clinic. We have enough behavioral health professionals. Oh yes, no shortage. That would be wonderful. And also providers turning to that behavioral health professional. Okay. Oh, sustainable funding, that's a great one. Value-based care intervention integration, yes. To work with some of our payers, right? Get those arrangements in place. Every clinic is equipped with a behavioral health therapist on site. Yes, that would be wonderful. We have when all the providers, medical and behavioral health, are sharing important points about patients. Yes, so that communication piece, right? Let's see, success means willingness to help, responsive to feedback, possessing a collaborative effort, and having adequate staffing. Yes, so again, that communication, the staffing, we have to have funding to have the staffing, right? Behavioral health sees clients like the rest of the clinic and staff as a part of their visit. Yes, yes. It's just standard care right there, right? Shared mission and goals, absolutely. Success looks like having providers and behavioral health consultants working together to provide behavioral health consultant services to maternal patients. I know we have achieved this when rural sites in the grant program offer and have maternal patients participating in BH services. Yes, that's a really important time to make sure we've got behavioral health support. Awesome, awesome. Well, I love this vision, and I know that we are all here today. We are working to move forward in this, and we're going to get there. We are going to get there. It's going to take some time, but we are on the road, and that's the exciting part. So, okay. So since some people already are, you know, doing integrated behavioral health and you're working on tweaking things, and some people here are trying to get started. And so I just wanted to point out that if you are in, you know, unless you are forming a new clinic, starting from scratch, to do integrated behavioral health is likely going to involve some changes to your practice, right? And so you're going to need to make changes and adaptations at different levels. And so you're going to need, starting with the leadership. So there will be practice and executive leadership changes, leadership support that is needed to make this happen. You'll need changes at the clinic and, practice level. So like actually interacting with the patients. And then of course, in the payments and financing side, we got to make sure that we can bill for all of these amazing services, right? And so there are different changes that you can make at these different levels. It's a lot when you look at it on this page. And I'm not suggesting that you should do all of these all at once. In fact, I am suggesting that you not do all of these all at once, right? And if you are interested in going through the journey of taking your clinic to being an integrated clinic, I'll just plug Mental Health America of Greater Houston. They've got some really great programs to help guide practices through that in a really good incremental way. But what I want to talk about is what some of these changes might look like. So at the leadership level, you've got to have leadership endorsement, right? This is going to take resources, and to get those resources, you've got to have buy-in from your leadership rounding. They need to be walking around, knowing what's going on, having behavioral health guiding principles. So getting this into the mission and vision and the principles at the clinic level. Professional development, you have to be able to support your existing providers to make these changes, right? We can't just expect people to show up one day and be able to change the way they've been working. And then hiring for value and equity. So looking to make sure that, you're hiring a behavioral health provider that's the right level for your clinic, and that is somebody that represents your patients and is someone who can really connect with your patients. And then in terms of the actual clinic and practice changes, and you all hit the nail on the head in the chat here, there's a lot of teamwork that's involved, right? So you're going to have providers working together in a way that maybe they weren't before, or working with a new team member that maybe wasn't there before. Screening, there's a lot of screening that is going on right now, but maybe you need to incorporate a new screening, and watch those screenings over time. What are the PHQs look like over time? Model fidelity. So there's different ways to do integrated behavioral health. And so whichever model you're picking or that you select as the best path for your clinic, there are going to be certain elements of that model that you need to make sure you're following. Measurement-based care. So again, what are those tools that you're going to look at over time? And maybe you're looking at a specific subpopulation. So you want to look at your PHQ-9s of, your patients with a diagnosis of depression, for example. And then family and patient-centered care. So this is really, involving the patient, involving the family in their care plan as you're integrating behavioral health into your clinic. And then
I just have to say that a lot of the people in the chat are actually echoing what you're just explaining to them. Veronica said, when patients are receiving the integrated behavioral health services with smooth processes, collaboration, and adequate staff, more behavioral health specialists, sustainability.
Yes. And I can see the next one too, having providers understand how we can be utilized to help patients, not just with anxiety and depression, but as well patients with high blood pressure and diabetes. Yes, so really taking a broad view of how the behavioral health consultant is a part of the team, right? So going beyond that traditional view of, oh, I have a patient who seems, a little depressed or a little anxious, I'm going to refer them to my behavioral health provider, but you've got a patient who's struggling to take their medication every day. And that's something that your behavioral health consultant can help support that patient with. Thank you, Sujina. And then going back up to Veronica, your comment about sustainability. So the payments and financing, right? I mean, when it comes down to it, we do need to get paid for these services, right? So everyone, you would not be on this call if you didn't have a huge heart. You would not be in your profession if you didn't have a huge heart. But we do have to pay the bills, right? So our contracts need to be set up so that we are getting paid for these services. In terms of your, billing and accounts receivable, you need to be set up so that you can actually bill for the, behavioral health codes, the health behavior codes. You may need to look at your scheduling template, right? So are you able to, do you have those scheduling templates, appointments for both types of slots for both types of appointments available? And can the same person do that scheduling? Are you submitting those claims in a timely fashion? And then financial viability. So going through and actually seeing, what are you billing? What are you actually being reimbursed for? So it's a lot, and it's from the top level of your clinic, the frontline providers in your clinic, and then the administrative side. It really takes everyone to make this happen. And so if you're making those changes, how are you going to know that a change is an improvement? Well, we have to measure it, right? And unfortunately, if it's not measured, then you can't necessarily claim that you have made progress, because you're going to have to be able to show that. And I'm going to attempt to show you all a video here that talks about key performance indicators. And I'm going to pull this over and see, can you all see this YouTube screen now, or is it still on my slide?
Yes, we can see it.
Okay. And then I'll pause it real quick and make sure you can hear it as well. Can you hear that?
Yes.
Okay, awesome.
In this short video, I'm going to introduce different types of key performance indicators. For the first 4 types, we will use a framework called the logic model. The logic model is a framework that is helpful for differentiating what we produce from what we can only influence. It is also helpful for separating between elements that are more operational versus those that are more strategic in nature. For every key process, we spend resources like time, money, raw materials, and other inputs. Then every process has measures that can be tied to that particular process. The outputs of my process are what we produce. Ultimately, though, I want to create an impact with my work. Outcomes capture that impact. Let's look at some examples of these types of measurements in real life. If I am a coffee maker, my input measurements might focus on the coffee, the water, or my time invested. My process measures could have anything to do with the process of making coffee, from the efficiency to the procedural consistency. The outputs of my process would be the coffee itself. I could have a variety of measures around the quality of my coffee output. Finally, my outcome measures would be related to things I can only influence, such as if my audience enjoys or buys the coffee. There is certainly more value in measuring impact than there is operations. If my customers enjoy the coffee, I'm doing something right. But you really do need a mix of both to truly understand performance. To fully understand all of the elements of strategy execution, I can then add a few other broad categories of measures to my story. Project measures monitor the progress of our improvement initiatives and projects and can be designed to improve operations or strategic impact. These track things like scope, resources, deliverables, or project risk. In my coffee example, I might have a branding campaign to sell my coffee. Employee measures tell us if employees are performing well or have the right skills and capabilities needed. I might measure my employees' skills in making coffee, for instance. Finally, risk measures tell us if there is an important change in a risk factor that could have a significant impact on our organization. For example, I might have a risk indicator that tells me if global coffee bean availability becomes a problem. The information that these different types of measures provide can be used to inform decision-making. Using a family of measures like this can broadly inform your entire strategy. To learn more about key performance indicator development and implementation, please look into one of our.
Okay, so we're not going to talk about coffee today, but what I liked about that video was their use of, they're framing it with a logic model. So I do research and program evaluation. And so logic models come up a lot in my world. And so I put together this is, I would call this just a draft integrated behavioral health logic model. And you could think about this in your setting. So what is happening for you? And again, you're not going to make all of these changes all at once. But at the leadership level, what is happening? Are you getting, leadership buy-in? And, are they putting in financial resources? Has there been a behavioral health consultant, a new one that was hired? Or how are you doing that? Is that somebody that was already on the staff and their duties are being shifted to allow them to provide these additional services? A process outcome that we will talk a little bit more about, though, is leadership endorsement. So what are you seeing from your executive leaders to know that they are on board? They are endorsing the fact that you all are integrating behavioral health. And then what you might see is some leadership rounding. So actually walking around the clinic, and again, we'll go into this one in a little more detail in a couple of slides. And this rounding is, there's an observational piece, but it's more active than that too. And then an outcome of this, leadership buy-in, leadership endorsement, and the rounding is having a culture that truly promotes integrated behavioral health, right? So it's not something that's seen as maybe you're using some grant funding to get started, but this is not something that is seen as like a grant funded initiative. And when the grant funding goes away, so does the behavioral health consultant, right? But this is something that is here to stay. You've got that collaborative culture, and your schedules are set up so that you can do that. At the practice level, your inputs, you're going to need your behavioral health provider, your behavioral health consultant, and you've got an integrated team, right? Things that this team can do is get together and have team meetings, get together and have team huddles, and you can measure these things, right? You can measure the number of integrated behavioral health team meetings that you have, the number of team huddles that you have. And then you can go on into, having warm handoffs. And again, these are things that can be counted, and you can say, how many you have done in a particular period of time. What behavioral health services are we providing? So thinking about your traditional, evaluation and management codes. But then going beyond that and going back to the comment about helping your patients that have hypertension, what are the health behavior services that are being provided? And those can be seen in your HBAI codes. So looking at your use of those codes and counting the number of times those codes are used. You can count the number of patients with whom those codes are used, but that you're seeing your actions, you're able to quantify that. And then through these actions, you would be able to look at your outcomes of, improved quality of care, improved access to care, and ideally improved patient satisfaction with the care they're receiving from your clinic. At the payment level, You may choose to measure something along this row. So looking at the billing codes that you're putting in. So at the baseline, when you're first getting started, are you already billing any of these behavioral health codes? Maybe you're not. Maybe you don't have anybody that's providing that just yet. And that's a good baseline, right? So you just want to know, where are you right now before you get started? And then you need to look, are these billing codes activated? Like, are you able to use them in your system? And then you also need to take a look, and this is a tedious task, but looking at your contracts with your various payers. Are you able to, so how many of your contracts are approved for behavioral health billing? Is your behavioral health consultant, I want to say accredited, and that is credentialed with each of your payers. So, and these are all those behind the scenes things that really go into the process of laying the groundwork for you to get going on actually getting to the point where you can see outcomes, right? And then in terms of your outputs here of the payments, you can look at how many of these procedure codes are entered into your EHR. What is your time to claim submission? So you'll have the date of service. How long is it taking for those to be submitted? And it might be longer at first, right? Because your billers are getting used to putting these in, and maybe they need to go in a certain order. Maybe they need a certain modifier. But so how much time does it take to get these claims submitted? And then of course, everybody wants to know the percent of these claims that are reimbursed. And an important note here is studying the claims that are not reimbursed. So what is it that if you've got claims that are being rejected and they're not being paid, why? What do you notice about that? And then you can go to your team, maybe your behavioral health team meeting, and you could share this information and say, hey, y'all, for some reason, we've got, these claims are being reimbursed for some providers and not for other providers, but really taking that team effort. And again, not thinking of the team just as the direct care providers, but at all levels of the clinic, front of the house, back of the house, to get everybody's input on what might be going on. And ultimately, you end up with a new revenue generating line of service, right?
Angie, we have a question in the chat.
Yes.
Mary Luz is asking, would you be able to provide a list for which BHCs can bill?
I think we have a list that we can share. Yeah, Sujin, I think we can work together to get that list.
Sure.
Yeah. And then oh yeah, no problem. And then of course, for our patients, you are offering these services to existing patients. Maybe word gets out that you're doing this, so you get new patients coming in. And then you want to know, like, how many of your patients are seen by your behavioral health provider? And I saw some great comments in the chat about, it just being a part, that everybody is seen by your behavioral health provider. You probably can't start there, but you could work toward that and see what that looks like. How many of your patients have behavioral health treatment plans? How many were seen for, health behavior services? And then, of course, ultimately, what we want to see is this bottom right here, right? We want improved, physical and mental health and improved quality of life for our patients. So that's really what we're after. But we can't measure just this, right? We have to look at some of these other things along the way. And again, you're not going to be able to measure all of these all at once. But you need to have some of these counts coming along so that if this is happening, wonderful. you could celebrate that, and you should celebrate that. But if something is not happening, if you're not getting some of the outcomes that you hoped for, you want to be able to go upstream and figure out, okay, well, why didn't that happen? And so you want to be tracking information on your processes so that you can go back and figure out where you may need to continue to tweak things. So what will you measure? That is something that you will decide at your clinic level with your team. What data will you need to report that, and how will you collect that data? So again, you want to start with the end in mind. What is it that you want to be able to say? And in order to be able to say that, what do you need to collect? And is that something that you already have? Like, is this a report you can run in your EHR? Is this a report that you're already running? Or do you need to maybe collect some new data? Do you need to do some primary data collection and collect some information that is not currently part of your standard practice? So for example, if we talk about leadership endorsement, first and foremost, everyone needs to be on the same page with what that means, right? So if I asked, I think I can't see the number of people on the call, there are 33 participants. If I asked you all to define leadership endorsement, I would probably get, what do you think, 25 different definitions, maybe even 33 different definitions for leadership endorsement. So you need to have you need to be able to operationalize this and have everyone on the same page about what these measures mean and how they're defined. So MHA has put together, an operational definition for leadership endorsement that that says that at least one executive leader communicates the integrated behavioral health plan to staff in large and small meetings. So this might be board meetings, this might be executive meetings, clinical meetings, team meetings. Okay, so you get the idea. And that the executive and clinic leader communicates the integrated behavioral health impact on patients. So first of all, they're saying, these are the things that we're doing. We believe in this. We've hired a new person, or we have changed the duties of an existing provider so that they're freed up to do this. And it's not just a one-time announcement where we're going to do this and then you never hear from them again, but you get ongoing communication, right, about how it's actually going. And so how might you measure this? This is a pretty simple tool that can help you measure something like leadership endorsement. And this is just a log, right? So you have the date, you have which executive leader made the announcement, what type of meeting was it, what type of communication. So was this something that was shared in a presentation at a meeting? Was this something that was sent out as, an all staff email? Who was it to? And was there any feedback or any concerns that were communicated back to that leader? And then from this log, you can get a real simple count. You can get a quick, oh, there were, 10 examples or 10 instances of leadership endorsement for our integrated behavioral health initiative. But then you can also look at who's doing that. Is it just one of your executive leaders? Is it a variety? Do you have something from the CEO, something from the COO, something from the CFO? Like, are they all sharing in the endorsement, or is it only coming from one person? The types of meetings, is it all just in staff meetings, or is it a mix of board meetings, staff meetings, all staff announcements? You get the idea. So you can see just a straight up count, but then you can learn a little bit more about the endorsement activities that are going on just by keeping a log. Another change that you can actually measure is leadership rounding. And again, got to start with that operational definition. So the definition we have here is that leadership rounding is counted if an executive leader or sponsor visits the unit and takes time to observe daily work. However, it should also include one of these next bullet points. So this isn't just going and standing back. Yes, there might be some standing back and just sort of observing to see how things are going, but this is an opportunity to offer coaching, recognize the hard work that the staff is doing, because this is not easy, right? I mean, and you're asking people to change the way they do practice, and that's hard. Change is really hard. Role modeling, okay, if something is doesn't seem, I don't want to say not quite right, but somebody is still working on something, maybe they are in a position to role model what that could or what that should look like. And then asking questions, asking genuine questions. And that can be, how's it going? Do you feel like you have what you need to integrate or to implement this model? If you don't, what is it that you need from us? So having this two-way communication, and again, to keep track of, oh no. Okay, my screen just went black. My goodness, that's scary. Can you all see my screen again?
We can see your screen, but your video is frozen.
Oh, okay, but you can hear me okay.
Yeah.
Okay. Like I said, new place. So there's a leadership rounding tool that could also be used. And this is something that, each time the person goes out, you have the date, you have the time, is this a 15-minute round? Is this a 45-minute round? Where were they? Especially if you've got different locations. And then what happened during that rounding? And all of these don't need to happen every single time. I want to be clear about that. But what tends to happen the most? By the time you have one of these rounding forms filled out each time, you'll be able to say, oh, when we do this, we're doing a lot of resource identification. We're doing a lot of coaching. But then also getting a count of the number of employees or patients or families that you're interacting with, basically what all is happening on that round. And there may be things that you want to add to this, there may be things you want to take away from this, but keeping track, not only that the rounding was done, so you can get a count, we had our executives conducted, 10 leadership roundings in this 6-month period, whatever it may be. But then you get a little more information about what actually happened. And then this is very important, follow-up action taken. So again, really, really showing that, demonstrating that buy-in and that endorsement. Okay. Oh, this is funny. Okay. Some of my screens are frozen, but I think you can see team-based care now, right?
Yes.
Okay. So for team meetings, again, this is likely something new or something that is at least an adaptation to standard practice. So you're going to want to get people together and talk about how it's going. So you can think about having your PCP, your behavioral health consultant, medical assistant, your clinic manager, your scheduler. So again, thinking of your entire staff getting together, and this would be like a monthly meeting. This isn't something that maybe early on you want to do it weekly, but you could decide what is the right cadence for you. And then talking about those shared patients, how are they doing? But then also talking about the processes. How is it actually going? Are people able to do the things that are expected of them? Are you seeing the outcomes that you were expecting to see? What tweaks do you need to make to your system? So in those meetings, you can have, this standing agenda template so that you're not doing something different every single time, but you've got different levels. You're talking about what's happening at an administrative level. You're talking about, you might have your RACI chart, which is where you talk about who's responsible for what. Are you doing PDSAs? Are you testing, new changes to your process along the way. And then really talking about those shared and complex patients. And again, maybe you don't do all of these at every meeting, but if you are recording this information in a standardized way, you'll not only be able to say, how many of those meetings you have, but you can really look at the quality of those meetings, and you can look at the variety of topics that are being discussed. And again, importantly, follow up. Were changes that were discussed at the meeting actually implemented? And you would have notes of that from your team meetings.
Angie,
Yes.
there's a black rectangle thing that's blocking on the left end of the screen.
Okay, I don't see that. Let me stop sharing and try to share again.
Yeah,
Let's try that.
let's try that.
Okay, how does that look?
Much better.
Okay, excellent. Thank you for letting me know.
Mhm.
And then this is just a log of that you could keep of those meetings. So every meeting would be jotted down here. So this is sort of a high level, one-stop shop. Oh, look at this. We have been meeting every month like we said we were going to. Great. But then the details of those meetings are in those, annotated agendas. Another thing that MHA has done a really great job of defining are team huddles. And so this is, many of you are probably already doing these, but these are different from your team meetings, right? So this is, a quick 5-minute meeting in the morning. Maybe it's a 15-minute meeting in the morning. 15 minutes, you might be going, oh my gosh, you clearly are not in a clinic because no one has 15 minutes, right? But whatever amount of time you are able to get together, in the morning, looking at your list of patients for the day. Is there anything you need to follow up from yesterday? And is there anybody who you can see on your list of patients for today who you're like, we definitely want the BHC to come in and chat with this patient. Please be available around 11:15. And have those talks. And again, those are quick, and you would decide who all needs to be there. But ideally, this is a multidisciplinary group that is at the table having those discussions. And again, you can have this real quick checklist. What day was it? What day of the week? Because maybe if you want to start having team huddles, you're probably not going, if you're not having them now, you're probably not going to start having these every single day at 7:55 a.m., right? You may start with, let's have these on Tuesdays and let's see how they go on Tuesdays. And if that's going well, maybe you feel like you're able to then, have your huddles on Thursdays, right? And so you can just check like, what day of the week it is. And this is meant to be really fast, really easy to fill out, but again, helping you track that data so that you can say that you can go back and you have your proof that it happened, right? This is your data. And then the log here is a little bit different. So looking at, this could be a calendar, what days of the week did you actually have a team huddle during that month. And so again, this is that high level, one-stop shop kind of, oh, okay, look at this. We had 2 huddles every week during the month of July. And so you can see that at a glance, and you can see if that changes over time. Like, have you been able to work from 1 huddle a week to 3 huddles a week? Because you are tracking those. And then, of course, there's going to be measures that we have that are based on claims data, right? So looking at your screening codes, looking at the reason for the consult. Was your BHC in there for a physical health reason, a health behavior code, or were they in there for something that was behavioral or mental health related? Was this an initial visit or a follow-up visit? And in certain models of integrated behavioral health, you're really looking to have more initial visits than follow-up visits. You are really making sure that you want to have a mix of physical health consultations and behavioral health consultations. Is that happening? You can look at your claims data and see. And maybe these are reports that you already have created in your EHR. Maybe they're reports that you need to create and run, on a weekly basis, on a monthly basis. Again, if you want to be able to report on this in 6 months from now, take a look at what data you already have. Are you going to be able to report it in the way that you want to? And if not, you may need to work on creating a new report now so that you've got that infrastructure there ready for you. And then you can move to the next level with your claims, looking at, this would be a specific measure, your screening, code submission, and reimbursement. So you're entering, behavioral health screening codes for your PHQ-9, how many are entered, how many are submitted, how many are reimbursed, what is the percentage of those that are reimbursed? And again, you don't just want to stop there, you want to have those reflective conversations. And is there something, the ones that are being rejected, is there something that they all have in common? Are they all with the same payer? Were they all entered by the same provider? And if you bring more people to the table to look, there may be something that you're just missing. So for example, we were told at one clinic that there was one provider whose screenings they weren't being reimbursed, and they were doing these screenings, they were incorporating them into their well child visit. And long story short, what happened was it had to do with the order in which they were entering those codes. And when they were entering the code for their screening, that was becoming the primary code for the visit, as opposed to it being a well child visit where this was done. And so the billers were having a little bit of a hard time figuring out what was going on. And then as soon as they talked to the providers, though, the providers were like, oh, we can see what's happening. So again, those team meetings together to go over your data. And again, same here. So looking at your traditional mental health submissions, your HBAI code submissions, you can look at the date these services were provided. You can look at what the CPT code was, if there was a modifier, who was the provider. So you'll have the date of the service, you would have the date that the reimbursement was submitted, and hopefully you have your date paid, right? So this is just one way that you could track those. Again, what the report looks like from your system may vary, but you want to work on that early on so that you're not 6 months down the road going, oh yeah, let's go back and get that information, but you needed to have entered something differently, or if you want to report on it later, you need to look now to see if you're able to do that. Okay. And then there are some helpful resources that are out there to help you continue in your journey, help you get started on your journey. So the National Council for Mental Wellbeing just released an updated comprehensive healthcare integration framework. I will, in a minute, while I have an activity for y'all, and while you're doing that, I'll put these links in the chat. But this was released in April of this year. So this is, hot off the press, and they've sort of, this is from the group that used to have the scale of 1 to 6 on measuring your level of integration at the clinic level, and they have revamped that scale. So I will admit, I am still digging into that and learning more about what they have done. But this is a document that is out there for you as a great resource. And then Valent, they have put together a list of 20 important key performance indicators that could be used to measure behavioral health performance. And they've got everything from looking at what you're doing for marketing, into the services provided. So those are resources that are out there if you are interested in checking those out. Okay, So that was a lot of information, and I want to stop here and give you a moment to sort of think about one indicator, one measure that you might be able to use in your clinic. And maybe you have one that you're already using that you want to share with us. That would be wonderful. But I'm gonna give you a couple of minutes to think about something that might work for you. And here's an example. So 6 months from now, by November 30th, 2022, we will conduct integrated behavioral health huddles 3 days a week, okay? And in order to measure your success, you're gonna need a couple tools. You're gonna need your team huddle agenda and notes, and you're also gonna want that log so that you can actually count the number of huddles that you had. And then what's this gonna look like? So this is something that you are planning to report to your executive team as the average number of team huddles per week each month from June to November. So you'll have, like, in June, we had 0.5 team huddles per week, right? Because some weeks you had 0, some weeks you had 1. You get the idea. You were just getting started in June. But in July, maybe you were able to average, 1 team huddle per week. In August, you kept going with the 1 because you were sort of tweaking it. And then maybe in September, you were able to do 2 team huddles per week. So looking at this over time, you would be able to show your progress. But in order to be able to report that 6 months from now, you need to be keeping track of that now so that you're not in November going, oh my goodness. So back in June, I know that we started them, but when did we do them? You want to be collecting that information right now. So I'm going to pause there for maybe 3 minutes and give you a minute to think through one of these on your own. And then if there are, I'll just give you a heads up. If there are any brave souls who are willing to share, we would love to hear from you at the end of that time.
We have one from Carmen. Angie, she said, in 3 months, we will conduct monthly direct care clinical meetings and bi-monthly direct care leadership and clinical leadership.
Excellent. I like that.
Anybody else?
That's been really important for us. This is Carmen, by the way. Hi.
Carmen, it's great to see you.
Yes. I've missed you guys now that you
Me
got everything up
too.
and running for us quantitatively. So thank you. And I felt so bad right after I answered. I go, wait a minute, our QMP is working awesome because of your guys' efforts. So thank you. We feel like you've got a really good handle on it. But as far as the direct care and the clinical team, there's just been a disconnect. A lot of times direct care staff are oftentimes interacting with the clients 80% more than the clinicians are. And so they feel like if they get called in, it's more to get in, we're going to the principal's office. There's a perspective there.
Mm-hmm. So I wonder, do you think that if you have the more regular meetings with everybody there, you think that will help with some of the openness of communication, but also with everyone feeling like they are everyone is part of the same team, right? But I mean, if you feel like you're getting in trouble when you go to this meeting, maybe more regular meetings with the feedback would help with that.
Yeah, and what we're even trying at the clinical, I talked a little bit about the clinical and the direct care supervision, is really in almost moving a little bit away from the official meetings to like weekly or daily huddles where the clinical team will go downstairs right before they leave. They'll touch base with the direct care staff and give them an update. Hey, if a client is acting this way, this is what's going on with them. And I feel like that's actually more effective than having those meetings, because then you get them into the monthly meetings and they're like, we're all sitting there like bumps on a log, or maybe they don't recall everything that's happened over the. So takes out to warm up a little bit, and as doing it on a base seems to be more active. They've been on for a week
Great,
now.
great. And do you have an existing like data collection tool to help you gather that data as you go along?
Yeah, it's really honestly, it's problem solving, and for us, it's more how the direct care sometimes isn't equipped in a way for emotional regulation and then effective communication. And it's a process, self-calming, a lot of times when you're dealing with our clients as well. So those are the pieces. So to quantify that might be a whole nother project for you guys.
Hit me up, let me know.
Okay.
Angie, we have another two comments from William. He said, review and update their logic model by August 31st, 2022. Mercedes Ingram said, by September 2022, we'll have bi-monthly meetings on behavioral health integration, starting VHCs in maternal OBGYN clinics to include direct providers, MAs, PAs, nurses, leadership, LMSWs, and LPCs.
Excellent. Mercedes, I love the specificity there about who the patient population is, who are all the variety of providers that will be there, and the frequency of those meetings. So that's great. And then as you're having those meetings, if you're, again, keeping track of the fact that it happened and what those issues were and the follow-up, you'll be able to really track your progress, both quantitatively and qualitatively. And let's see here at Access Health, I can see we have 30-minute weekly team meetings, conduct warm handoffs, counselors via face-to-face and telemedicine sessions, as well as quarterly leadership rounding visits. Awesome. Out informatics, IT team is accessible for technical support via onsite and Zoom. This is great. Are these, Shirley, are y'all tracking those in a systematic way right now?
Yes, we do weekly meetings. We send out to the entire team and leadership, as well as informatics do track all of the patients that we see and visit, and we also do follow-up.
Wonderful. Wonderful. And then someone made a comment about updating their logic model. I like that. You can definitely see what I'm going to stop sharing so I can see y'all's wonderful faces. And that gives you the chance, to really go from left to right, right? What are our resources that we're going to invest? What are our inputs? What are the things that we're going to do? What are these things that, we're going to count? And then getting all the way over to, and these are the outcomes that we're hoping for, or that we're aiming for, not just hoping for, but we're setting ourselves up to work toward these outcomes. And again, being able to not necessarily, depending on your staff, right? I mean, if you and your capacity, but starting with measurements that are doable, right? And not feeling like you have to measure everything all at once. But that's a really great place to start, because that also gives you, you have your one sheet, that one table that shows all the things that you're after. Well, thank you all for sharing those. I appreciate that. It sounds like there's a lot of good work that's already happening out there. And I think just in conclusion, it's okay if I don't share this slide. I can just tell you what it says. But yeah, in conclusion, so again, measurement is important, right? People are going to want to know, you can tell them what you did and, you know, try to think about all the things that you did, but really and truly, when it comes down to it, you've got to be able to put, you know, some quantitative and some qualitative results and findings down on paper, right? So again, you can't measure everything, but you need to think through the details before you get started. So if you do want to measure, you know, your team huddles, or you do want to measure, you know, the claims that are being reimbursed, what data do you need to do that, and work backwards, right? And are these data that already exist in your system? Is it something that you've already got? You just are maybe not using it in that way. Maybe it's a monthly report that you're already using and you just need to add it to your bigger annual report. Who knows? Or do you need to create some new data collection tools? You know, is there something that you know you're doing, but you're not writing it down? That's really what happens a lot of time. Is it's stuff that you are doing, it's just not being written down. And so again, thinking about what will that reporting look like? If you want to be able to say in your annual report that, you know, you screened, you used your PHQ-9 in 90% of your well child visits. You've got to have your denominator, right? You've got to be able to count the number of well child visits that you did. And then you've got to be able to count the number of times the PHQ-9 was done at that well child visit for you to get that percentage. So yeah, start small and involve your whole team. And I think you all have shared many examples of that, of using your whole team to help move these efforts forward and really reflect on how things are going.
I also like Veronica. She just shared her comment, and she said by November 2022, we will gather and review data on reasons for referrals, screening scores, and initial versus follow-up behavioral health contacts. That's a really good one.
Yes, love it. Love it. And so if you're going to do that by November 2022, again, you want to be looking at the data that you're already collecting right now. Is it already being collected? And you'll just need to, you know, pull out those measures and calculate them, or is there something that you need to, you know, is there data you need to collect, and how does it need to be formatted into a report? And these sound like such mundane little tedious details, and they take time. It takes time to think through this stuff, but it's really important, and you want to do that as early as possible. Any other questions or comments? So Carmen has a question: what type of data collection is being done? Do any of you who are working on integrated behavioral health and tweaking your systems now have anything you can share on what sort of data collection you're doing right now?
Typically, the only measure that I can think of right now for us is there a reduction in the number of grievances being filed? Is there a reduction in the number of care and concerns being filed? But that's really, I was hoping there might be some other type of measure that might be available or consideration when we're thinking of a collaborative effort, and other than with the client measures. Just throwing out there if somebody had any ideas. Thanks.
So Carmen, are you thinking like a organizational level measure?
I'm sorry, I didn't understand. The question was all
You-
muffled.
Oh, I'm sorry. You said that right now you have, what you have are patient level data, and you're looking for something different from patient level data. Are you looking for like organizational level data?
More organizational, like measuring, you know, like the quality of the collaboration, maybe between the clinical team and our direct care. It's like how to quantify that, other than saying, you know, doing like surveys and saying, well, do you feel like we're working better together? How do you feel like it's improved? Do you feel like there's more teamwork? Is there willingness to help? I mean, those are all.
That's a
candidates.
great one. Is anybody out there
Oh.
measuring that amongst their team? I mean, I think you could do that through a survey, sort of like a pre and post, and see, you know, how that changes over time. But then some of the other things you may have are like, who all is coming to, you know, the team huddles, or who all is coming to the team meetings? Are those attended by, you know, a variety of provider types, a variety of staff members, or is it, you know, the same 2 people that come every time? And then if you had like outstanding issues, you know, how many of those are actually followed up on? Something like that might help.
Okay, no, that's a good idea. Yeah, like at our monthly meetings, you will usually have 15 to 18 staff, and the ones that aren't attending are the ones that are on third shift. You know, we try to make it available via Zoom, but I mean, they're either working or sleeping as well. So
Yeah.
we
Oh,
try to
that's tough.
change the times away a little bit around, and that's our biggest challenge. But yeah, so documenting and then just following up on it and in that part. Okay, that's a good start. Thanks.
Sure, sure. Okay, so we have a request for some CPT codes, and we can get that list sent out. Any other questions or comments from anyone today?
Before
Hi,
oh, sorry, go ahead, Carmen.
this is Mary Liz. Just real quick, I didn't know if you, the request you talked about, the CPT codes, was my request, but I was asking more for like a list of services, like something that I can go back to our providers and say, look, this is what a behavioral health consultant would be able to assist you with. Because our grant program also has perinatal case services. I just want to make sure I'm not mixing up the two, or maybe there's some things that they both might do. So that's the kind of list I was looking for. I don't know if that.
Oh,
would be
gotcha.
possible.
Gotcha. Okay. I think, Sujina, I think we could probably either we have that list, or we could come up with one, just examples of ways the BHC would be involved.
Yes, we can definitely provide that for you, Mary Luz. Angie, you and I can work on that together. But also on that note, we're actually going to announce that we're going to be hosting a behavioral health consultant focused Project Echo soon. We're doing an info session, which will be led by our wonderful Alina. And the entire series, there will be 6-part series, and they're actually going to be focusing on the different roles a behavioral health consultant could play in integrated healthcare. So we'll be sending out announcements and link for registration soon. If I'm sure we've already distributed first announcement, but we'll continue to do that. But if any one of you are interested in registering for those series and want to be a part of our info session, please reach out to me and I'll send you the registration link individually to you all. But it's going to be held by some really amazing experts, such as Dr. Stacy Oakbide and Dr. Ebony Winford. So if you definitely want to be a part of that, I think this will be great if you want to learn more about the behavioral health consultant's role and what they can help in the primary care setting. So before we close, if anyone have any question, please reach out or. Okay,
Well, thank you all so much for being here today and getting your week started with us.
thank you all so much. I'll see you all next month again. Angie, thank you as always. You were great.
Oh, my pleasure. Always great to be here and see some familiar faces out there. So